Infertility and Yoga. Now, as I said, yoga has got plenty and innumerable benefits. Now, it offers a solution for those people who are suffering from infertility as well. Now, infertility, when we take, it occurs both men and as in women. Now, what are the different causes for infertility in women? It is congenital abnormalities. It is something which is there when the person is born itself, and there is pelvic infections. When a lady is affected by lot of infection in the pelvis from the childhood days or from the girlhood days, then it carries forward and it becomes a problem when she wants to conceive. And there is something called as endometriosis and irregular ovulations, thyroid, and there is something called as PCOS. Now it is becoming very common, and I came to know that it affects around 50% of the women nowadays. And I was also told that this occurs because of the injections or the medicines which they give for the cattle or the cow, so that it does not ovulate. So when the lady takes this medicine, she doesn't ovulate as well. And what are the different causes for infertility in men? There is a low sperm count. There is weak sperms that will not swim well. So you may be having 25 or 30 million or 60 million sperms in your semen per ml, but if all of them are weak, or if it does not swim properly towards the destination, that is the ovum, then it is not going to be of any use. And smoking, drinking, undescended testicle, excess of cycling, and stress factors, these are the other reasons for one becoming infertile, a man becoming infertile. Now let us see how yoga fits into this. Now, stress affects or reduces fertility by reducing the blood flow to the pelvis. See, you should know that when a person is affected by stress, the whole body shrinks or it contracts. So when it contracts, the main point for the stress to get affected is the shoulders and the lower back. So if the same thing happens to the pelvis, so there is going to be a reduction in the blood flow, and this reduction in the blood flow is going to affect those organs in that area. And stress increases the cortisol level. See, our cortisol, our friend or our good old friend, enemy, the cortisol is playing a havoc in everybody's life, and that is increased with stress. And it interferes in the menstruating, and it affects the lady in miscarriage as well. Yogasanas reduces stress and it relaxes the pelvis. There are few asanas which we can teach in our institute for the ladies and gents, and I have seen there are a lot of persons who have benefited because of these asanas. So it increases the blood flow to the pelvis. We call it as a hip opener. There are few asanas which we will see. So it is going to increase the blood flow to the pelvis, and the problem is another psychological problem is with the ladies or the gents is they have to accept whatever has happened to them. Now people are suffering from the pelvic disorder or related diseases which makes them infertile. So they have to accept it, and if they accept it, then the depression and anxiety reduces, and this paves way for the treatment in the longer run. This does not happen with people. People get into stress and depression and anxiety, and this is going to adversely affect the infertility, and whatever be the type of treatment they take, it is going to be of adverse effect. It is not going to work. So definitely, positively I am telling, this increases the reality. We face with the courage, and there is an increase in the confidence level of the person who practices yoga. And there are few asanas which we will be teaching for those persons who are suffering from pelvic disorder and infertility. Thank you.